There are conditions that seem to be affecting men more frequently than women. So for example, cardiovascular disease tends to affect men at an earlier age than women. So that includes things like heart attacks and strokes. Men also are at higher risks of liver disease, lung cancers, lung conditions like COPD, skin cancers. This may partly be explained by differences in lifestyles between men and women, but may also be explained by the fact that men tend to frequent their GPs less than women do. This means that they're less likely to receive health promotion, but also less likely to have conditions picked up earlier. This is why it's so imperative that men are aware of signs and symptoms to look out for, and that they're aware of their family history so that they know what they're at more increased risks of. Prostate cancer. This is the most common cancer in the UK in men. Often it has no symptoms at all, but for some, if the tumour does grow large enough to press against the urinary tube, it can mean that their flow is not as strong. It might mean that they are straining to pass urine, having to pass urine more often, or that they don't feel like they've fully emptied their bladders. If you have any of these symptoms, you do need to speak to your GP. They may examine you and may take blood tests. From then, you might be referred to a urologist. Testicular cancer. Whilst this cancer isn't as common as prostate cancer, it does affect people at a much younger age, which of course has significant effects later on down the line, especially when considering fertility. The main symptoms of testicular cancer include a painless lump, a change in the shape of the testicle, or a change in the texture of the testicle. If you notice any changes to your testicles, do speak to your GP. They will examine you, they may order an ultrasound scan, or refer you straight to a urologist. Mental health. It's not only with physical health that men are more reluctant to see their GP, but also in terms of their mental health. Unfortunately, we know that 75% of the suicides in the UK are in men, and it's the leading cause of death in men under 50. It's therefore so important to look out for signs and symptoms in yourself and others of depression. So that can include things like low mood, anxiety, feeling of helplessness or hopelessness, feeling worthless or that you'd be better off not here. If you're having troubles with your sleep or your appetite, these are also signs. So if you've tried some self-help measures and they're not helping, please do speak to your doctor.